everyone, this is Andrea Autry, and today we're going to do the MAPP assessment for PAP tests in Kentucky. All women in the United States are potentially at risk for cervical cancer, and around 12,000 women are diagnosed every year. It is often found in women as young as 21, all the way up to women in their 60s. Early on in the development of cervical cancer, there are oftentimes no symptoms. This allows the cancer to go undetected and spread. It is only until the cancer is advanced that symptoms such as vaginal bleeding, discharge, and bloating begin to send red flags that something is wrong. Luckily, there is an easy and reliable way to find cervical cancer early or to find any abnormal cells before it begins to develop. These tests are called PAP tests and are needed as infrequently as every 3 years. Even though PAP tests are quick, easy, and can catch abnormal cells before they become a problem, women are not receiving them, particularly in Kentucky. This PowerPoint will take a look at the population in Kentucky, what the ideal vision to get women screened would be, and assessments and strategies to get more women in Kentucky regular PAP tests. Kentucky leads the U.S. in new cancer diagnosis rates, as well as highest rates of cancer deaths. Kentucky does not have a great reputation for pushing for cancer screenings. Therefore, a large portion of Kentucky's money is spent on cancer treatments and related costs. Kentucky also has the highest rates of cervical cancers in the U.S., which could possibly be prevented if more women received their routine PAP tests. Only 72% of women in Kenton County, Kentucky report receiving routine PAP tests in the last 3 years. Failure to receive cancer screening tests such as PAP tests are highly correlated to poverty, being uninsured, and lack of education or awareness. The poverty rate in Kentucky is 24.9%, and Kentucky women are being diagnosed with cervical cancer at a rate 1/3 higher than the national rate, and the death rates of these women are 37% higher than national rates. If Kentucky would place more focus on being proactive rather than reactive, many lives could be saved and possibly the state could experience a cost savings. Through regular testing for cervical cancer via PAP tests, abnormal cells can be detected and caught early, as well as catching any disease such as HPV, which is known to cause cervical cancer. The Healthy People 2020 national goal is to increase the number of women receiving regular PAP tests to 92%. This goal could be achieved, as we will see in the next section. Kentucky's resources are plentiful but underutilized. In order to increase the number of women in Kentucky receiving regular PAP tests, finding and engaging stakeholders will be necessary. At first glance, one could assume that there are a minimum amount of stakeholders, and the majority stakeholder would be women living in Kentucky. However, this issue affects everyone in the community on some level, whether personally, emotionally, or financially. Clearly engaging Kentucky women as stakeholders is extremely important. They bring to the table what is really needed in regards to educational, financial, physical, and emotional needs. These women could serve on planning task forces, offer program design and execution suggestions, use their social media to market, and if trained properly, offer education in a peer-to-peer environment. The next stakeholder is also an obvious choice, which are healthcare facilities such as hospitals, women's health centers, and Planned Parenthoods. These facilities can offer their knowledge of PAP testing and cervical cancer, as well as their knowledge of the local needs of the community. Their facilities could also provide a benefit to use as a location for PAP testing. The local health departments should work in conjunction with these facilities to provide education, locations for testing, marketing, and data about the local community. Also, engaging the OBGYNs who work in these facilities, as well as hospitals and other clinics, would provide more knowledge on task forces, provide staff for testing, as well as education in the community. In order for programs to really work, especially in regards to policy, I believe the public health practitioner needs to get creative. One stakeholder I would attempt to engage who could really have an effect on policy is the Joint Commission. The Joint Commission has a lot of pull on hospitals and the way that they practice. Working with the Joint Commission to develop standards for hospitals in regards to how PAP tests are administered, suggested, or offered would be crucial. This partnership could have a huge impact on how women are reached in the community. Also, I believe another creative stakeholder would be colleges and universities, as women in the target risk for cervical cancer are also college-aged. These schools can provide education and awareness, as well as school nurses who could possibly administer tests. Getting universities involved on task forces can provide academic strategies as well as knowledge of the targeted population. Lastly, getting community members, taxpayers, and charities involved would provide the financial backing the program would need to provide testing as well as utilize facilities. These community members could also volunteer as office staff or work on street teams for marketing purposes. Since everyone, both male and female, can be affected by cervical cancer, it would be ideal to engage men in these street teams as well to provide their perspectives. With the help of these stakeholders, I believe that my program can make my vision a reality, that cervical cancer death rates will drop significantly because women will be able to receive regular cervical cancer screening without the worry of cost, transportation, childcare, modesty, or privacy. Kenton County, Kentucky has a population of 163,929 with a median age of 36 years old. The median household income is $54,817. King County's average personal income is $27,704. The unemployment rate is 4%. The largest racial ethnic groups are whites at 89.4%, black at 4.6%, and Hispanic at 2.8%. 17% of Kenton County's population is uninsured, while 80% of the population reports having a specified general practice physician. Through my research, Kenton County is known to have a large number of physicians, declining rates of smoking, and increasing rates of eating fruits, vegetables, and exercising. It seems that the largest issue for women not receiving regular PAP tests is lack of employment and insurance coverage. As mentioned earlier, Kentucky has a poor reputation for being reactive rather than proactive in regards to cancer and cancer screenings. However, upon assessment, Kentucky does have a number of underutilized services, which, speaking as a woman living in Kentucky, I had no idea existed until I began this assessment. Some of these resources offer a number of great services and funding, though some could be adjusted to ensure that women are aware of the services and that they are available to all women. The Northern Kentucky Health Department offers low-cost cancer screenings, such as PAP tests, to residents of Kentucky. The cost of the tests are priced on a sliding scale to make it affordable for everyone. They also offer follow-ups if the tests come back abnormal. The Cervical Cancer Free Coalition is also involved in the state and holds 2 state summits, which gets local communities involved in cancer prevention and even makes educational videos on HPV vaccination and PAP tests. Kentucky also has the Foundation for a Healthy Kentucky, whose mission is to approach centers on developing and influencing health policy to improve access to care, reduce health risks and disparities, and promote health equity. Since 2001, the foundation has invested more than $24 million in grants, health policy research, educational forums, and training. The Kentucky public health infrastructure is vital to ensuring that the number of women receiving regular PAP tests is increased. Each component can provide a service or a benefit to reach the Healthy People 2020 goal. The components of the Kentucky public health infrastructure are epidemiology services, which serves to analyze community-based health data. It provides surveillance of disease, injuries, and monitoring of health status. Another component is essential public health activities, which serves to inform, educate, and empower the local community. By completing these activities, policies can be developed, services and residents can be linked, and research can be conducted. Geographic information systems is utilized to map trends and spatial relationships. Population-based research is used to develop primary, secondary, and tertiary prevention plans. Privacy and security is also a component in place to protect the population from unauthorized users of health information and protection of identity. Lastly, public health services, laboratory services, which provide surveillance, quality assurance, consultation services, and core sets of testing. All of these are vital to improve health of the community and will be used to increase the number of PAP tests in Kentucky. Epidemiology must be utilized to understand what is happening in the community and how it is affecting the population on a numerical scale. Public health activities will inform the public about what was found in the epidemiological assessment and how to prevent or control it by education and policy development. Geographic information systems shares that information with other communities. Research can empower the public health activities by providing the prevention plans to be followed. Privacy and security empowers the community to seek help for any condition to be treated, and laboratory services provide screening. Current policies. Congress currently has in place the Breast and Cervical Mortality Prevention Act, which authorized the CDC to provide cervical cancer screenings to women in underserved areas, women in poverty, and women who experience other health care disparities. The Kentucky Women's Cancer Screening Program also provides PAP tests to low-income women in all counties. This is funded by state and federal funds. Since the initiation of the Affordable Care Act, cervical cancer screenings will be more obtainable through the American Reinvestment and Recovery Act by providing services and electronic records to share information. Though it was implemented in 2015, there is still work to be done ensuring that all underserved women get access to screening. Though the nation as well as Kenton County is working towards providing care and screenings to the underserved, there is still a lot of work to be done, as seen in the poor rates of women receiving regular PAP tests in Kenton County. Kentucky has high rates of cancer deaths and, as mentioned above, spends more money treating cancer than preventing it. Until more policies are in place and enforced regarding screenings and prevention, Kentucky and its women will continue to have poor quality of life and low life expectancies. Though increasing the number of women in Kentucky who receive regular PAP tests presents a number of strategic issues, with some stakeholder engagement and creative thinking, these can be overcome. The biggest issue we face is that Kentucky is known for being reactive rather than proactive when it comes to cancer prevention and screening. The goal for this issue is for Kentucky to become more proactive in regards to cancer screening and prevention. Specifically for this program, we are focused on cervical cancer and increasing the number of Kentucky women getting PAP tests. To reach this goal, strategies such as creating more policies that would encourage general practitioners to provide PAP tests as an alternative to seeing a specialist or OBGYN, which could be more costly to the patient. One way would be to mandate general practitioners to reach a quota of PAP tests given in a year. Also, possibly requiring those covered under Medicaid to receive a PAP test in order to keep their benefits or possibly pay some type of penalty. Kentucky health departments offer cervical cancer screenings. Costs are adjusted via sliding scale, which is based off of income. These facilities also offer follow-up visits if results come back abnormal. This is a great benefit offered by the state, but it would be ideal for every woman in the state to receive one free screening every 3 years, regardless of income. Even though the health department offers PAP tests on a sliding scale, some women may still not be able to afford the test, even though their income may state that they can. Every woman's situation is different, and even though her paycheck may indicate the ability to pay, her funds may be required to go to something else, such as childcare, transportation, student loans, or other bills and debts. Some strategies to overcome this issue would be to lobby to government officials to provide funding for free PAP tests to all women regardless of insurance coverage and income, and promote more supportive organizations such as the Kentucky Women's Cancer Screening Program. Also, to persuade general practitioners and OBGYNs to also meet a free care quota, offering a certain number of free PAP tests a year. The final issue found could be null and void if the above goals were implemented, but in the meantime, 17% of Kentucky's population is still uninsured. This makes PAP testing unobtainable for some women in the state. The goal would be to decrease this number by 5% over 5 years. This goal could be met by involving stakeholders and by more promotion of the ACA and the actual benefits reaped. More availability and information on where to sign up, for example, placing a Connect kiosk in libraries, physician offices, grocery stores, universities, and colleges. In order for this issue to be resolved, Kentucky must change its culture and become more proactive in cancer screenings. Though I do believe the state is attempting to make changes, they need to get more creative about where to receive resources and who to get involved. By thinking outside of the box and engaging organizations such as the Joint Commission, colleges and universities, and all community members, more women can be educated on why PAP tests are important, how infrequently they are needed, and that they have options regardless of income or insurance status.